Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us, and it's always an honor, we have Lesia Alexander. She is an animal communicator and energy healer of heart and soul with animals, and she's speaking on the topic this evening, understanding your animals, senior care. Thank you so much, Lesia, for being here with us.
Well, thank you, Elizabeth. It's always a pleasure. Yes, so today, let me start the screen share here. And okay, so this thing is in the way. So this happened last time too, and I don't remember how to, come on,
Oh, yes.
move the
So,
bar at the top.
yes. So if you start the slideshow and then eventually it'll kind of the share bar will kind of fade out.
I'm trying to, no, it's not the share bar. It's this meeting is being recorded bar on the top, and it's right on top of where I need to click on for a slideshow,
Oh
and I can't.
shoot.
So let me just see if I can, here's what I can do. uh, creative genius at play. Well, don't know about
Look at
perfect. Okay, so there we go. So so welcome to this talk, and my name is Les Alexander of Heart and Soul with Animals, and we're going to talk about senior care today. And I want to start by asking you all, do you ever wonder what your animals are thinking, right? Do you worry about what they need when they're acting out or distressed? You're baffled as to what to do. Well, I decode animal behaviors so that you have solutions that work. And some of the things that I work with are wellness and health in conjunction with veterinarians. I work with behavior issues, and my specialty is working with senior and end-of-life animals. But before I go any further, I want to talk a little bit about how this started for me. I think it must have been like 40 years ago. I was at the foothills of the Himalayas at the mouth of the Ganges River. I had just walked out of this glacial water, sopping wet, freezing cold, and had this moment where I felt like I was being anointed by Mother Ganges, Mother Earth, Mother Nature. And it's like, and I knew at that point in some part, that my life would be about serving Mother Nature, Mother Earth, and all her creatures, including humans. And it wasn't until about 15 years ago when I was sitting in meditation one morning, 2 years after this beloved Scotty, my soulmate dog Hinsa, came to me in spirit and said, "You need to do animal communication." I said, "Animal communication? I don't do animal communication. What do you mean?" And he reminded me that I had studied earth medicine for like 14 years, and I did all these like animal journeys, animal blends, animal vision quests. I had spent years going to zoos, like repeatedly, and building relationships with the animals in zoos. I even had this green parrot like Grandilectus in a pet store. They used to go after my bracelets. He was a buddy, because I just loved animals. And then he also reminded me that I had spent like 30 years working with gemstones and with intuitive readings for people, and how I could use those skills to serve animals. So I thought, okay, I'll give it a shot. And I explored, and I'm like, oh my gosh, I do this. And the thing he reminded me, the most important thing, was the years I spent living with my animals and what that was like, what I learned from them, how I communicated with them. So I left my many years of teaching and to do this work. And I then further invested in educating myself. So I am a Healing Touch for Animals certified practitioner. I've trained with sound healing, and now I help people and their animals. And I promise that if you're interested in more of this, I'll let you know later how we can go deeper with that. So we love our senior animal companions. And we love all our animal companions, but there's something about spending many years with an animal and just the closeness that happens, there's nothing like it. And we really want to take care of them. But just like like with a child or a partner, they, like turn around one day and oh my gosh, my partner's got gray hair. How did that happen? Or boy, you've gained 10 pounds. Or my kids were like this, now they're like this. It's really hard for us to notice when we live with someone. So that's what I want to talk about. Really some basic um, signposts of what it is to get older and what's behind it and what you can do about it. So changes can be subtle. So we don't always notice, when an animal slows down. It's not always obvious to us. Or when they start resting or sleeping more. Or maybe their appetite changes slowly over time. And behaviors also, they may start having repetitive behaviors, or behaviors might start to morph a little bit. Breathing issues are not something that we will necessarily notice. And just like hair gets gray or thins out, I'm not saying patches of hair that we would notice, but those are the sorts of things we sometimes don't track. And we also don't want to really think about our animals getting older. So sometimes we also just don't want to see that. But what's really behind that? What's really happening? Well, in the many, many animals that I worked with at the end of life, and this happens with people as well, animals have crises where they go down. I've had so many people come to me when their animals have gone down and they say, oh my gosh, I think this is it. I think we've got to take them to the vet. I think this is the end. I can't tell you how many times this has happened. I check in and the animal's like, no, I'm not ready. I'm just going through some stuff. And I will say to the people, give them a few days. If they don't get any better, then, you could go, take them to the vet and see what the vet has to say. So many times animals have lived 2 weeks, 2 months, 2 years longer, after that people understand there is that advance and retreat to death. They go down, they rally, and then they have this new normal that's less optimal than before. And then they go down and then they rally until they can't rally anymore. And I just want to say that today I'm focusing more on the senior care. I will be having a talk in August where I'll be focusing on end of life. So that will weave in today, but I'll try to save some of that for later, for the other talk. So recently what animals showed me, and then this all may seem pretty obvious, and it really is, but I don't know, I as a human constantly need reminders of the obvious because for many reasons I forget to notice, I don't want to notice, I don't want to know about it, and I need to know about it. So what they showed me was that you have, like, let's say they're going along and their kidneys start to go down and the body adjusts. And then they're going along and another organ or another system starts to fluctuate and get a little less functional. But what happens sometimes is when you have the kidneys go down and then now they can't access this mineral in their body, so they can't get the neurological thing happening or this, and like several things intersect. And their body's like, red alert, we can't manage all this. And that's when they go down. And with time, their bodies will readjust. So that's sort of like more of a description of how that works. And some of the pretty typical things that happen with aging animals is they'll get muscle atrophy and arthritis. So that's like a bone, muscle, joint kind of issue. They'll have hearing and vision loss, and that's hard to see sometimes. That's hard to, no pun intended there, but that's hard to track sometimes because again, it's not really obvious and they're compensating as they go along. Dementia, that's something also that may creep in that may not be as obvious. Kidney and thyroid issues, especially for cats, cancer, heart disease, diabetes, and then digestive function diminishes. So some of those subtle things are reflections of this. But then there are some not so subtle kinds of things. So they can be quite disoriented. And that could be dementia. It could be hearing and vision loss. And then they have yowling or barking incessantly. Sometimes dogs, when they lose their vision, they can see slightly and they'll interpret something and then they'll get triggered to go on alert. And I had a client come to me and I'd been working with her cat for years. And this cat was starting to yowl like really intensely, and it was driving her crazy. And she was worried. It was besides driving her crazy, she was worried that he was in pain. And when I worked with the cat, it turned out that his hearing was gone. And so the ears and the brain were disconnected. But he wanted to hear him. He when he would yell, he would do the yelling thing and he couldn't hear anything. So he had to magnify it, get it bigger and louder so he could feel the vibration in his body or his ears so that he could respond, like he could feel like he was expressing himself. So so that's one of the things that they can't hear themselves. The other thing is that they want reassurance. So they'll call out for reassurance. Dementia is another reason animals will yowl like that. So these are all things to, to think about, and these are signs of aging. Obviously, if they don't follow commands, it can be either dementia or hearing loss. Vomiting, again, digestive issues, um, and constipation, diarrhea, incontinence. Um, Another animal I was working with, had worked with him on and off for years, had really good life, was on a really fabulous raw food diet. He started having chronic diarrhea as he was getting older. And I was lucky to have had the opportunity to work with a alternative vet who was trained in Chinese medicine. And she explained that as we get older, sometimes with illness and with age, that the digestive system just doesn't have the oomph. And so it's almost like they need, quote, pre-digestion, which would be to cook the meat would be one thing. The other thing would be to break it down. So like anything from hamburger to baby food consistency that helps them to be able to absorb, to digest and absorb the nutrition. So that I recommended that they cook his food, have it be more like hamburger, and the diarrhea stopped. Another situation um, with incontinence was a little Lhasa Apso guy. Their family came to me and they said, well, I think it's time. I think he's got a little, it looks like he's got a little dementia and he's incontinent. We don't know if it's his time yet. Could so I checked in with him and he said, no, 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 I'm not ready yet, but I'm having this pain down below. He said, yes, I'm having little episodes of dementia. He says, it's disorienting. My vision and my hearing isn't really great, but I'm not ready. I need to wrap up. I have the other things I still need to do. So they took him to the vet. Sure enough, he had a urinary tract infection. So they were able to address that. He had no more pain. Unfortunately, the incontinence diminished, but it didn't go away. But they were able to finish, he was able to have some comfort, and then they were able to, everybody was able to say goodbye. And then when it was his time, it was really obvious to everybody. Another not so subtle thing is weight loss or gain. That could be digestive issues. It could be not enough exercise or too much exercise. It could be diabetes. It could be thyroid issues. So really keeping an eye on those sorts of things. And then swelling, lumps, and bumps. A lot of times when animals age, I would say more so dogs, they can develop lipomas and lymphomas. So it's really important, I think, to um, get tested, um, you know, to make sure it's not cancer. And more often than not, vets will say, if it's lipomas, just leave them. It's more stressful for the animal to do the surgery to remove them than it is for them to live with it. Um, about a year ago, maybe a little bit more than a year ago, I had an emergency call from a couple who had a dachshund mix, and she had a big lipoma on her chest. She was having blood in her stool, and they really thought it was the end. And when I worked with her, she said, no, no, it's not the end. I've got more life in me. It's not time yet. We did energy work. Things cleared up. She didn't like that lipoma on her chest, but the vet had said that it could, if they tried to remove it, it's possible she wouldn't make it through the surgery. So they left it. And they thought, okay, a few weeks, few months, it's a year later and they've got this little jacket for her to help her when she's walking around, and she's still living with that and she's still having a good life and they still get to enjoy her. Another thing, not being able to jump on the couch or the bed anymore, that could be the arthritis, the muscle atrophy. Um, it could be not being able to see where things are. And then another thing is trouble walking at all, but also stiffness and we assume soreness after walking. And so, yeah, so those are some not so subtle things that you can look for because I think being informed is really important. Okay, so let's go. Hang on. All right. So what can we do for them? And when we are caring for elders, whether they're animals or people, it takes more energy. It just takes more out of us. So it's really important to take care of yourself first, to cultivate self-care so that you are able to be there for them. It's really important. And those of you who have, heard my talks, this is one of the things I talk about a lot, these two things, is having a kind of neutrality, having a kind of separation from yourself and your animal. Like, like what happens if we get really, really worried, it could really amplify it for them. It could really stress them out. So it's okay to have all our feelings. It's okay to say to them, hey, I am so worried. I'm just don't know what to do. But and you can let your animals know it's not your job to take that on. My job is to take care of you, but I love you so much. And the thought of you being in pain or you leaving is really, really hard for me. And I'm taking care of you. So that's really important. And that neutrality and calm. And again, it's such an important thing. Calm is like a really baseline of working with our animals. Even with behavior change, with anything, because if we can be calm, they can trust us. It also can teach them how to be calm. And then they are able to cooperate better with us. And then the other thing is, we need to address their changing needs. And we need to, again, have clarity. What do animals need? So we'll start with the physical. They need the appropriate food. So again, like that dog I talked about, the food needs to match where they are in their process. They need exercise. Maybe they need less. Maybe they need more. Maybe they need a different kind of exercise. Maybe they need to walk slower now. And they need calm and they need rest, more so as they get older. They also need stimulation. They need to be mentally stimulated. One of the things that happens is more often than not, people will over-exercise their dogs. They're not realizing that it's painful for them. Whereas with mental stimulation, often people will understimulate their dogs. They're thinking, oh, he's just old, he sleeps a lot, but just like with humans, we need to keep that brain active. That will help all the connections work better. It will help them enjoy their life more, and it will help us have that exchange with them. So for dogs, I always like to talk about the sniff quota. Just because they're older, it doesn't mean that they don't have amazing amount and magnitude of smell reception in a way that we humans could never understand. And when we are created for something, when we do what we're created for, it is satisfying inherently and it's pleasurable. And so it's really important to maybe you're walking them slower, maybe you're not walking them for as long a walk. Give them the space to sniff the funk, that is just so pleasurable for them and it will stimulate their brain as well. And play. Maybe you think about how are we going to play in a way like maybe slow down or, like with cats, you speed up and you slow down. Just slow the whole thing down or maybe have shorter play periods and not to forget that they still can learn things. So they're still can learn new things. And that is again going to be pleasurable for them. People also sometimes forget that just because they're sleeping a lot, they can't see very well or hear very well, they still need the emotional relational connection with us. They still need the love, they still need the physical, but it need maybe slow down. So instead of the kind of thing or the roughing up thing, sometimes maybe just slow it down a little bit. And that just really depends on where they are in their process. And then finally, animals, I believe they're the part of how their spirituality manifests is in their jobs. They're very clear about their purpose for being here. And I believe all animals have jobs with nature and the earth. And those they're in charge of that. They know how to monitor that. But with us, they also have jobs with us. So I'll share with you about my own cat. He was in his late teens, and we started having rats, and we had done everything for rat protection. And I had, and we had also told him, you're retired now, you don't have to work. But I was kind of freaked out about the rats, and I said to him, "Can you help?" And he looked at me and he said, "Look," he said, "I'm retired. It hurts to jump up on the couch and hurts to jump down. I don't think so." He said, "But I can still monitor the territory." And he would go out the cat door and he would like make his round. It used to be the entire neighborhood, and it had gone down just to the backyard, and he could still hold that energy and hold the sort of the energetics of the home boundaries that created our home space. And he could do that quite well, even though he couldn't jump up on the couch very easily anymore. So really having that sense that they're not useless, they still have jobs, but maybe some of the jobs they used to have aren't um, appropriate anymore. And like one of the jobs that sometimes they're running companions for people, that wouldn't be appropriate anymore at some point. By the way, the rat thing got resolved. It was through the cat door that they were coming in. So we got the little collar and they could get in and out with the little magnetic thing, and that took care of the problem. And then how do we know if what we're doing is too much or not enough? And I'm going to give you 3 tips for this. It's case by case. We need professional support, and we need to talk to our animals. So case by case. So do your research, know your species, breed, and their aging propensities. Cats and dogs are different. Like that if you have a a finicky like a finicky cat and they stop eating, that might not be as big a deal, as if you have, let's say, a dog who's always eaten everything, and now um, all of a sudden they don't want to eat. So then you need to look at, am I giving them too much of some kind of food? Am I not giving them enough? Is that too, because they have to keep eating. So those are like the kinds of clues. And then your own animal's personality. You know um, what's different for them. Okay. So for example, I'll give you an example of 2 different dogs. Worked with the dog for a while. She had cancer in one of her back legs. They had gotten some medical support, and then there were a couple of myself and another person working energetically, and that cancer went into recovery, and she had some years where she was just fine. But her people were really very hyper about that back end and that back leg. And so as she started getting older, they started really curtailing her activity. And when I worked with her, it turned out that she actually, like, she needed more activity to keep the muscle strength up. So these are kind of like there's no cookie cutter here, It's like the journey of birth, life, living, dying, and death. Like, sure, there's signposts that are the same for all of us mammals, for animals, but each journey is unique, and how they navigate that, we need to really just, there is no like formula for it. We just have to watch, and we do the research, we get the professional support, and we experiment. So anyway, so when they started upping the exercise level, that actually helped the dog with her muscle tone. because we want to keep the muscle tone as good as it can be for as long as possible. Another situation, I had worked with these folks and their dog for years, on and off. They were very fit people. The dog had 3 walks a day and sometimes clocked 6 miles a day. So the dog, as the dog got older, the dog would come home after walking and go to sleep and then be really, really stiff getting up and kind of walk really stiffly. And they thought, oh, well, just, needs to get more exercise and kind of loosen it up. Well, as it turned out, when I worked with the dog was in pain. And it was really, really too much for the dog, because here again, we want to have that balance. We don't want too much, because that will then they'll the muscle atrophy will go faster. I mean, just it's that Goldilocks place. And again, the thing about caring for seniors, and especially caring for animals, because they can't communicate to us the way people can, is it's just, we just have to be present to that and know that we can't be 100%. That's one of the really, really tough things about this. You can be an animal professional, you can be a veterinarian, you know, we can't be 100%. Even with humans, we can't be 100%. We make choices for our elders that we look back on, we wish we hadn't. And that's a really important piece about getting support for yourself, is you do the best you can. And what the animals have all told me, if you're coming from your heart, then whatever you do is okay. Because you can only do what you know how to do. And then finally, get professional support. So, of course, have a veterinarian on board. It's really important to go in and get the advice of the experts. They know, they are trained in this. Also really helpful to have an animal communicator on board who's going to give you information from the animal's perspective. And nowadays, it didn't used to be like that years ago. A lot of veterinarians are working hand in hand with animal communicators. Chiropractors, acupuncturists, massage therapists, they can work with your animal and they can say, oh, those joints are really not doing well. This dog really needs to, slow down on the exercise. Or, oh, this dog's really muscle tone is great. How much exercise, and you could say, well, how much exercise should I give? And they're going to know if they're animal chiropractors and animal acupuncturists, which there are out there, and animal massage therapists, they're going to have a lot of experience and be able to help you out with that. I don't see how one would do acupuncture with cats, but it's possible, but probably unlikely. Anyway, energy healing support is good anytime. And I think especially at this older age, when when we don't have our energy centers aligned, we can't access our energetic resources. And our energetic resources are like overlaid with our physical resources, with our physical system. So basically, once they get their energy centers aligned, they can access all those energetic resources. Another thing is having a homeopath on board. Homeopathy can look at certain behaviors, patterns, and then they can kind of figure out what's going on. And I have been extremely impressed with the very subtle homeopathic remedies, how they have affected animals that I've had. And then I've also referred people to homeopaths, and they've reported some really, really good results. And I've, definitely at that senior age for sure. And nutritionists. And I don't know of many animal nutritionists, but I know that was really, really good to have someone on board who can really assess for you what's going on. And the end of life kind of support is a little different than early on. Early on, we want animal behaviorists, we want trainers. We don't need that anymore. We need the kind of support that's going to nourish and give you the information that you need. And finally, this is something I always encourage people to do, is talk to your animals. And I don't mean just verbally talk. We as humans, when we talk, we usually have pictures in our head. We usually have feelings that go along with it. But what happens if your animal can't hear you anymore? So, and this is one of the things when I do, when I've done these presentations or I teach, I really talk about how to engage all your senses. So let's say you have your dog sleeping in the other room and she's hard of hearing, or she's, hearing impaired, and you want to get her to come in. And so you're not going to say, "Hey, Molly, Molly." Well, you could, but you could start by going over and lightly touching her and saying, "Hey, Molly." And with that, like imagine that you're inviting her, like you're kind of asking her, "Come on, Molly." That feeling of like, and you could even imagine that you have a leash on her and you're gently guiding her, "Come on this way," so that so she can start feeling that. Pictures, super important with animals. Start sending them pictures what you want. Let them, just give them that communication while you're talking. Give it to on as many sense levels as you can. Imagine the pictures, the sounds, the feelings, the sensations of it, the emotions of it. And then, because that will start building that sort of language between you. So that you can let them know, "Hey, I am taking care of you." I think that when they're older and you are taking care of them, you're trying new things, that you let them know, "Hey, I'm taking care of you." So they know that. Let them know why you're doing things. So one of the things that with cats as they get into senior years, unfortunately, cats often will have kidney issues and will need subcutaneous fluids, which definitely help them to feel better. And so let's say you want to get trained to do that. One of the ways you can do that by, quote, talking to them is you start giving them pictures. You're like, imagine that you're doing the sub Q with them, that they get the treatment, and then they feel so much better. So you just send them all those feelings and images. Then you bring over maybe like you bring over the bag of saline, and you just sit next to them and you do that same image. Then you bring and you do that for a while. And then you bring in the next thing and the next thing. Since then you have all the paraphernalia there while you're sending them that image. And then maybe you just take that needle, you don't uncap it, and you just put it where you would maybe put it if you did this, and just kind of send them that image, so that eventually that you're preparing them. It's like you're talking to them in a way they can understand, and you always flood them with that really good feeling afterwards. And then you ask them to help you understand what they need. And this is going to look different for different animals and different relationships with people. Um, because once you start having that dialogue, sometimes it's really hard to know what they need, and see if you can develop some kind of system of where you're like, well, what do you need? Is this food working for you, or is this food not working for you? And you can experiment with things, but just talk, share, and trust that they get it, and then practice that feeling, like it's almost like practice having this, oh, okay, we're going to connect now. And it's like you open up this tunnel, not this tunnel. You could think of it as a wire or a strand, or maybe, a tunnel where there's this energy, you have this pathway between you, and so you could even have certain signals. You could even have like a picture of something, like maybe a dog biscuit or a rose or something, like, okay, we're opening this up now. And then you practice. And then for whatever amount of time, it's like you're attached to each other for that amount of time, especially if they're older, they can't see. You can't live like that because you have a life, you have to do your thing. If you're home a lot more, some people will spend a lot of time with their elderly animals like that, if they have the space to do it. But it just gives them a reassurance that you're there with them, and there is this pathway of communication. Oh boy, I was gonna say, I'm looking at the time. So I wanted to thank you all for showing up, because what this says is that you really care about your animals. So I really thank you, because I do believe that the relationships we have with animals make us better people, and better people make a better world. So I just want to thank you for that. And I want to thank you for supporting Marlene's, and thank you for supporting me. And as a way to show my appreciation, I want to if you're interested, give you a spring tip sheet for your animal companions. So that some tips about things you can do to help your animals in the springtime, because seasonally there are different things we need to pay attention to. And if you're interested in that, just put your name in the chat, your email, and just say spring tips. And for those of you who are interested in going a little bit deeper with my work, I'm going to offer 4 what I call senior care 30-minute complimentary phone conversations where we talk about the top issues with your animal and then see if there's a fit for us to work together. And if you're interested in that, just put senior care, your name, and your email. So there's also more on this talk still. What I want to do is I want to open the next section up. I want to open to questions because this particular topic, some of you may have some urgent desire for some better understanding about this. And would really like to support you. And I want to say that no question is inappropriate, that whatever you want to ask, end of life issues, dietary, I will not have all the answers more than likely if you're going to ask me about those sorts of like dietary things, but I do have some knowledge about that. So just whatever you want to ask, I'll do my best. And then we'll take about 5 minutes. And then after that, I'm going to do an animal energy healing for any animals that you want to include, whether they're with you or someplace else, and for yourself if you want to be part of that. So does anybody have any questions? And Elizabeth, if you'd be so kind as to read them if they're in the chat.
Thank you. Yes. Oh, I guess for someone's camera, um, it had froze about what was going to happen at the end, and I think that was the meditation, correct?
The healing, yes, the
Yeah.
animal healing.
Yes,
Kind of like a meditation, but yeah.
but way better. Okay, perfect. And just looks like I have a couple of people submitting their emails.
Okay.
Thank you for that. But folks, feel free to ask any questions. We'd love to hear from you.
Yeah. Either unmute or do it in the chat. So if you have any questions about aging or end of life issues, anything like that.
Oh, perfect. Can you diagnose or does know of anyone um the dog to let you know why she snores?
That sounds like a veterinary concern, I would say. Yeah.
And then Alicia said, please send healing to my puppy Millie. She is a senior and I can't detect her pain. Oh, and she posted a photo of her. What a sweet
Perfect.
angel.
We'll include Millie in the healing. Absolutely. Absolutely.
So then here we have someone in the waiting room. And then introducing new pet to older dog. That's a good question.
So I don't have a lot of information specifically about that, but I would talk to the dog, the older animal, let them know that the new one is coming in. What I know is that I think it's a little easier with dogs in some ways. If you have cats and you introduce new cats, that protocol I could talk about because I had to do that recently myself, and I haven't in the past, and the cats never got along. So I know there's that, but with dogs, I've had experiences where you let them know that dog is coming in, and it's really important that you assure your dog of their position. You are here first. This is what you're doing. We have this new one coming in. And a lot of times with dogs, the experiences I've had is that um, more often than not, if they're aging, they're happy to have a new one come on board who can take their place when they're gone. To pick up their jobs. So again, I would say talk to them, let them know what's going on, um, and then let them know when the new one's going to come, like that.
Beautiful. And Lynn said, can we include Lily, a 17-year-old cat with hyperthyroidism in the healing? Thank you.
And we will, that is actually the very next thing I'm going to do is ask for the very information you're giving me, which is beautiful. So we will definitely include Lily and Alice, well, no,
Millie.
who's Millie and Lily.
Ah, that's funny, Millie and Lily.
Okay. Okay. And I'll ask for the names of the other animals that we want to include. So I'll give it another minute and then we'll move on to the energy healing.
Perfect. We have a question from Mary. Do you know a good way to manage I'm gonna butcher this, vestibular disease? My 13 and a half year old dog is diagnosed a year ago and has had 4 episodes since. Unfortunately, he seems to recover. Fortunately, he seems to recover quickly each time.
So I am not a veterinarian nor a vet tech, so I'm not, that's really not my area. What I do when I work with animals is let you know what they're experiencing. And then you can take that to the vet and get some support around that. Yeah, I'm not able to diagnose or don't have a lot of knowledge of a lot of different things that can happen. I have some knowledge, of course. So sorry about that, but I would say I would take that to a veterinarian. Homeopathy is amazing for all kinds of things. So I will say that is try a homeopath if the veterinary conventional veterinary route has not been working for you. Try finding an animal homeopath.
Perfect.
They're usually veterinarians, not always, but yeah.
And
So,
Loretta said, can you include Luna in the healing? She's older. Jean said, Raina, my cat, relaxed but up for healing. Oh, and then Alicia said Millie has recovered from back end paralysis from IVDD. She's been on and off gabapentin, poor baby, and methylcobalamin. Her sight seems to be going as well as her bladder control. And is estimated to be 13. We rescued her many years ago. She has younger pups, age 5, that have helped her keep her young. Aw.
well, so thank you so much. So I'm going to go ahead and move on to the next thing. Oops, we've got this there. So, so what I'm going to ask you all, especially those of you who have um, requested that your animals be part of this. So if you have animals with you or animals somewhere in your life that you would like to receive this healing, if they're not with you, imagine them. But if they're with you, just basically let them know. So if you've got multiple animals, let all your animals know that you want them to participate in this. And why? Well, one of the reasons is that they'll help them to feel better, and then invite them to join in to this circle. And so we before I started, I created like a space that for healing. And then I have, you people are great. You're great because you like jumped ahead, like you kind of read my mind. So let us know in the chat a little bit about your animal companion. So name, age, species, breed, and coding. So um you don't have to, all you need is the intention to be part of this. So if you don't want to give a name, if you don't want to give any information at all, if you don't want to be part of this, it's all okay. But if you do, all you need to do is right now just set that intention. You would like to receive healing. You would like your animals to receive healing. And then we're going to hold space for all the animals that thank you for naming them, because I feel like it ups the energy when they're named. And thank you for bringing them to this circle. So we're going to go ahead and start. We're going to start, I'm going to have you start with yourself by taking 3 deep breaths. And know that when I was learning Healing Touch for Animals, when we worked with animals at a distance, we were able to use our own human body as a surrogate, or we were able to use a stuffed animal as a surrogate because our chakra systems are very much comparable. So that's what we'll be doing today. So you as a human can receive this, as can the animals. So just allow yourself to feel present, become aware of yourself and your animals, and then become aware of yourself and let your animals, like everybody can move into their own internal space, and the animals will follow, hopefully, with that. And today we're going to use a wand with green aventurine crystal, tumbled crystal. And aventurine is a healer, and it will go wherever it needs to go. And we're going to say that this healing, whatever happens in this healing, is for the best and highest good of all concerned. And so this gemstone will only do what is needed for your animals. So we ask that what we're doing here in this room will touch all the animals in the way that they most need it. So what I will do is I will let you know what I'm doing and let you know what I'm perceiving, and hopefully that will not disrupt any of this nice, calm, quiet internal process we're doing here. So I am moving this down from snout to tail. And I did ask the gemstone if it would be willing to do this work. There we go. Everybody's tuning in. So I was going from snout to tail, and then I started just going and back, snout to tail and back, snout to tail and back. And now I'm just going snout to tail and then back all the way up, just going in one direction now. And what that's doing is it feels like it's aligning everybody with this work and aligning everybody with themselves. And now we're going to allow the gemstone to give that first chakra whatever it needs. And what I am seeing is this energy going to everybody who's participating in their first chakras and kind of resonating at the frequency that it needs for each individual. And it's like a bunch of little frequencies going all at once. And now we're moving to the second chakra. And I'm definitely feeling some hind end relief starting to happen for some folks, some four-legged folks, maybe some two-legged too. Some grief is coming up, so we're releasing that grief. Doesn't matter whose it is. And now we're moving to the third chakra. So with the first two, we were balancing out the energy. With the third, it feels like um, it's almost like we have to release some energy. It was almost a little bit of energy built up. So that's what we're doing here. And there's a clear flow. So we're going to move up to the fifth. In animals, we go along the spine. So with the human, we would go to the fourth. With the animal, we're going to the fifth chakra, and then we go to their chest, the fourth, and then to between their eyes and up on top of their head. So we're now the back of the neck. I feel like I hear a lot of voices, like a lot of different communications, like different expressions happening all at once. And now we're going to the fourth. And that's opening things up. That helps energy from their chakras be able to move through. The energy field is opening up. And again, we're looking at this in a collective. And now the sixth. I feel some of the cats with us. When I went to the sixth, there was definitely some like clearing that happened, that started to happen. And I'm feeling like, I don't know that animals are actually getting up and shaking, but it's like on some level, there's like that shaking off things, that feeling of shaking things off and lining yourself back up. And then crown. top of the head, seventh chakra. Now I'm gonna just hold that point at that hind end. And then sweep down the left leg. Good. And then the right leg. And then hold that hind end again, grounding down both legs. And then the same, I'm going to hold the top and back of the neck. Going down the left front leg, going down the right. And back at that fifth chakra just to stabilize, anchor down. Very good. So then I'm going to hold the wand at the hind end, like with the wand and then with my hand, and then I'm going to switch. Just this is the stabilizing part. And I'm going to switch now. And then I'm going to go on outside either end, do the same thing with their connection to above and below. And there we go. Just so we really are kind of out of time, but does anybody have any quick comments they'd like to make of their experience, if they notice anything happening for their animals? Okay.
I don't see
So,
any input here, but
okay, this is, good way to end for tonight. So, thank you all for coming, and I wish you the joy and the pleasure and the wonderful benefits of your sharing your life with animals. And if you want to contact me, there's my info. And thank you so much for coming tonight.
thank you so much, everyone. And thank you so much, Lessa. You're amazing.